Hello everyone, and welcome back to another video. Today we're going to be diving into an exciting topic, peptides and their potential role in hair growth and countering the effects of DHT in androgenetic alopecia. We'll also be looking into some skincare and health aspects too when it comes to peptides. I am under the belief that scalp inflammation is important to treat as it would put the hair follicles in a good growth environment. Real quick though, please subscribe to the channel if you feel like these kinds of videos are helpful. Also, be sure to share it with a friend if you think the information would also help them as well. Finally, if you're able to, consider becoming a channel member for as little as $2 a month, or supporting through the Buy Me a Coffee link. All links to everything that I've said in the description below, as always. So, what are peptides? Now, before we get into the specifics, let's take a step back to understand what peptides are and why they play a crucial role not just in hair health, but also skin rejuvenation. Peptides are short chains of amino acids, the building blocks of proteins. In the world of biochemistry, they act as signaling molecules that communicate with our cells to perform various functions. Because of this, they have a broad range of applications in skincare, wound healing, and potentially hair growth. Peptides can be classified based on their size and the complexity of their amino acid chains. Generally, they are categorized into oligopeptides, which are short chains consisting of 2 to 20 amino acids, and polypeptides, which are longer chains containing more than 20 amino acids. These distinctions are significant because the size and structure of peptides influence their stability, bioavailability, and their ability to penetrate the skin and interact with cells. Some peptides may consist of a single chain of amino acids, while others, like those in larger proteins, might have multiple chains that form more complex structures. When it comes to hair growth and hair health, peptides may stimulate hair follicles, improve scalp condition, and possibly help mitigate the damaging effects of dihydrotestosterone, also known as DHT, a hormone that is linked to hair thinning and hair loss in androgenetic alopecia. In skincare, peptides are celebrated for their ability to boost collagen production, enhance skin elasticity, and promote overall skin vitality. According to the review article titled, quote, "Role of Topical Peptides in Preventing or Treating Aged Skin," unquote, by F. Garohi and H. I. Maybach, peptides are widely used in cosmetic dermatology to combat signs of aging. The authors categorize peptides into 4 main groups: signaling peptides, enzyme inhibitor peptides, neurotransmitter inhibitor peptides, and carrier peptides. They discuss the signaling peptides, for example, and how they stimulate the production of collagen and other matrix proteins, leading to firmer and more youthful skin. The review highlights various studies demonstrating the efficacy of these peptides in improving skin appearance and treating the signs of aging. One notable finding from the article is the efficacy of palmitoyl pentapeptide 4, which is a synthetic signaling peptide derived from procollagen. Garohi and Maybach point to a paper by researchers Robinson et al., where it was observed that palmitoyl pentapeptide provides significant improvement in the appearance of aging skin, with better scores in reducing fine lines and wrinkles compared to placebo. The authors also mentioned palmitoyl tripeptide 3M5, also known as sinocol, which is a man-made ingredient that copies a part of a natural protein called thrombospondin 1. Normally, thrombospondin 1 helps control a protein in our body called tissue growth factor beta, also known as TGF-beta, which can cause skin problems like inflammation and wrinkles when it's too active. By working in a similar way to thrombospondin 1, sinocol helps activate TGF-beta at the right levels, which boosts collagen production. More collagen means healthier, firmer skin with fewer wrinkles. There was a mentioning about a peptide in this paper that had briefly caught my eye, and it was about glycosaminoglycans. Before I bring this peptide up, I should first note that glycosaminoglycans, also known as mucopolysaccharides, are a type of sugar molecule found throughout the body. They are made up of repeating sugar pairs and play various roles depending on their specific chemical makeup. Garohi and Maybach mentioned that tripeptide 1 have been combined with palmitic acid to create pal-tripeptide 1 also known as biopeptide CL, research done both in vitro and in vivo has shown that biopeptide CL helps stimulate the production of collagen and glycosaminoglycans, which are important for maintaining healthy skin. However, it's also important for healthy hair. Also, this is where the mentionings of glycosaminoglycans caught my eye. Minoxidil, commonly used for hair growth, has a notable effect on the biosynthesis of glycosaminoglycans, such as heparin sulfate, partially oversulfated chondroitin sulfate, and hyaluronic acid in the extracellular matrix around hair follicles. This action supports a better environment for hair growth by enhancing the scaffolding where hair follicles reside. The study, quote, sulfation of minoxidil in keratinocytes and hair follicles and the stimulatory effect of minoxidil on the biosynthesis of glycosaminoglycans, unquote, by Y. Mori, T. Hamamoto, and S. Otomo, found that minoxidil undergoes sulfation in hair follicles and proliferating keratinocytes, which is a key step in its mode of action. This process not only enhances glycosaminoglycans production in these cells, but also shows minoxidil's role goes beyond merely improving blood flow to the hair follicles, indicating a direct and multifaceted influence on hair growth mechanisms. Now, looking at the review that Guruhi and Maibach did, they note that combining tripeptide 1 with palmitic acid forms paltripeptide 1, also known as biopeptide CL, which has been shown to stimulate the production of collagen and glycosaminoglycans, crucial for maintaining healthy skin. Integrating this with a sulfotransferase booster like tretinoin, which enhances minoxidil's efficacy, as noted in the study titled, quote, efficacy of 5% minoxidil versus combined 5% minoxidil and 0.01% tretinoin for male pattern hair loss. A randomized, double-blind comparative clinical trial, unquote, could potentially further augment the skin and hair follicle environment in a super-enhanced state of growth. My thinking is that while tretinoin boosts sulfotransferase activity, enhancing minoxidil's effectiveness, the addition of biopeptide CL could simultaneously boost glycosaminoglycan levels. This combination might provide a more robust approach to promoting more effective hair growth by reinforcing the structural matrix around hair follicles. The review points to the challenges that peptides face when it comes to skin permeability. Now, I find that this is an important aspect of peptides, because we have to understand how can we get peptides through the skin and to the hair follicle, or just other deeper layers of the skin itself, because peptides tend to be large and also hydrophilic in nature, and these two factors make it a very challenging prospect to use peptides in a manner that's similar to a topical minoxidil. So this prompts us to look at ways where we can effectively deliver the peptides to the targeted tissue. Challenge number 1, the Dalton rule and molecular size. To understand this challenge, it's essential to consider the Dalton rule. Bose and Minority in their paper, quote, the 500 Dalton rule for the skin penetration of chemical compounds and drugs, unquote, talks about this general guideline in transdermal drug delivery. This Dalton rule indicates that for a molecule to effectively penetrate the skin, its molecular weight should generally be less than 500 Daltons. Most peptides, being composed of multiple amino acids, often exceed this size. Their large molecular weight typically places them above the 500 Dalton threshold, significantly limiting their ability to move through the skin barrier efficiently. Challenge 2. Peptides tend to be hydrophilic. In addition to their size, peptides are typically hydrophilic, meaning they have an affinity for water. The skin, particularly its outermost layer, the stratum corneum, is designed to be a protective barrier. This layer is composed of dead keratinized cells embedded in a lipid-rich matrix, which is lipophilic. So, right off the bat, we can see how hydrophilic molecules, like most peptides, struggle to penetrate this lipophilic barrier. The stratum corneum's lipophilic nature favors the absorption of fat-soluble substances over water-soluble ones, improving transdermal delivery using carriers in solutions or gels. So in this case, most peptides, when applied to the skin, need to have some sort of enhanced means of delivery. One approach that Goruhi and Maibach discuss in their article is to have chemical penetration enhancers. These substances, such as alcohols, fatty acids, and surfactants, can temporarily disrupt the lipid structure of the stratum corneum, increasing its permeability and allowing hydrophilic peptides to pass through more effectively. One fatty acid that Goruhi and Maibach explore is palmitoyl derivatives of interferon alpha. They make special note on how it increases the lipophilic property of peptides. The palmitoyl derivative of the polypeptide interferon alpha is noted to penetrate across human skin 5 to 6-fold greater than just a peptide would be able to on its own. To make a peptide lipophilic, it is accomplished through the process of palmitoylation. This process occurs by attaching palmitoyl groups to peptides or proteins, which significantly enhances their lipophilicity structure. In the context of palmitoylated interferon alpha 2b, this modification alters the peptide's properties in a way that facilitates better penetration through the lipophilic layers of the skin. Another advanced technique discussed is the liposomal delivery system, where peptides are encapsulated within liposomes. These are small spherical vesicles composed of phospholipids, which can carry hydrophilic substances like peptides. Encapsulation in liposomes allows these peptides to be delivered across the skin barrier effectively because the lipophilic outer layer of the liposome interacts favorably with the lipid-rich layers of the skin. This method not only improves the stability of the peptides, but also enhances their penetration, making the delivery system particularly effective for topical applications. Nanotechnology and nanocarrier systems are promising tools for peptide delivery. These systems can encapsulate peptides within nanoparticles, which significantly increases their stability and facilitates their transport through the skin barrier. This is especially beneficial for larger peptide molecules, which typically face challenges in penetrating the skin on their own. The nanocarriers create a more stable and controlled environment for the peptides, ensuring that they can reach their target sites more effectively. Improving transdermal delivery using sound waves and electricity. I found Goruhi and Maibach's discussion on the use of iontophoresis and sonophoresis to enhance peptide delivery especially interesting. Iontophoresis works by applying a small electric current that drives charged molecules through the skin, capitalizing on the repulsion between like charges to promote the movement of ions. This method is effective for the rapid delivery of both charged and neutral molecules. In contrast, sonophoresis uses ultrasound waves to increase the skin's permeability by temporarily disrupting the lipid matrix in the stratum corneum. This disruption allows for the more efficient transport of hydrophilic substances, including peptides, across the skin barrier. I did some digging around at a university near me, and I found a study conducted by researchers from Montclair State University titled, quote, Enhanced Transdermal Drug Delivery by Sonophoresis and Simultaneous Application of Sonophoresis and Iontophoresis, unquote, by Juhaeun Park and colleagues. The research explores the combined use of sonophoresis and iontophoresis for improving the penetration of cosmeceutical drugs through the skin. In this study, researchers used porcine skin, which was chosen due to its similarity to human skin in terms of structure and permeability. This in vitro model allowed for a controlled investigation into how these physical methods could improve skin permeability for different types of drugs. The study found that using ultrasound waves, which would be sonophoresis, and electric fields, which would be the use of iontophoresis. When using these two forces together, it significantly enhanced the skin permeability compared to using either method alone. Specifically, the application of sonophoresis increased the skin penetration of niacinamide and retinol by 402% and 292%, respectively, illustrating its substantial effect on enhancing drug delivery across the skin barrier. The porcine dorsal skin used in the experiments was sourced freshly and stored at -80 degrees Celsius until it was needed. Before each experiment, the skin was thawed at room temperature. The integrity of the skin was carefully verified using a fluorescein application method. It involved applying fluorescein and using a spectrophotometer to measure the fluorescence signal. And because I would imagine a lot of you aren't familiar with a spectrofluorophotometer, because I sure as hell wasn't myself, a spectrofluorophotometer is a very sophisticated analytical instrument used to measure the intensity and wavelength distribution of fluorescent light emitted by a sample. So when a sample is exposed to light at some wavelength, a portion of its molecules absorb this light and then re-emit it at a longer wavelength. This emitted light is known as fluorescence. This tool is important in the context of a transdermal drug delivery study because a spectrofluorophotometer might be used to verify the integrity of skin samples. For example, after applying fluorescin, which is what we call a fluorescent dye, the instrument measures the emitted light to confirm whether the dye has penetrated the skin. So in this experiment, the skin samples that do not show high fluorescence, which would indicate no penetration of the dye, are considered intact and suitable for further experiments. For the experimental setup, the researchers applied different formulations of hydrophilic and hydrophobic drugs onto the porcine skin. The treated skin was then exposed to either sonophoresis, iontophoresis, or a combination of both. Sonophoresis involved applying ultrasound waves at 2 different frequencies. So there were between 280 kHz and 350 kHz with varying intensity levels, while iontophoresis utilized current densities of 100, 150, and 200 microampere per square centimeter. The simultaneous application involved using both ultrasound and electric current together. After treating the skin with the respective methods, it was mounted on France diffusion cells, a standard apparatus for studying drug permeation through the skin. The receiver chamber of the diffusion cell was filled with phosphate-buffered saline, also known as PBS. For a solution of PBS with 0.5% polysorbate 80 for hydrophobic drugs, the donor chamber contained 300 UL of the drug formulation. Samples from the receiver chamber were collected at intervals of 3, 5, and 24 hours post-application to measure the amount of drug that had penetrated through the skin. These samples were then analyzed using high-performance liquid chromatography, equipped with a UV and vis detector to quantify the concentration of the drugs. The key findings of the study indicated significant enhancements in the skin penetration of both hydrophilic and hydrophobic drugs when treated with sonophoresis. For instance, the hydrophilic drugs like niacinamide and arbutin showed substantial increases in penetration, and similar enhancements were observed for hydrophobic drugs such as retinol and alpha-bisabolol. Notably, the combined application of sonophoresis and iontophoresis resulted in the most significant enhancement in skin permeability, especially for the model drug glutamic acid. This is particularly important because the stratum corneum, the outermost layer of the skin, presents a significant barrier to transdermal drug delivery. Overcoming this barrier effectively can allow for non-invasive and convenient drug administration methods. The Goruhi and Maibach paper was especially useful in understanding how peptide delivery comes at a significant challenge on multiple fronts. However, the potential solutions offered gives us some utility in how to effectively deliver peptide in a transdermal way. Realistically, the other solution, and because we are talking about hair loss, would be intradermal and intramuscular injections of the peptides themselves. In fact, 2 such companies that are currently working on peptides that show promise in growing hair have done this in their clinical trials. Firstly, Follicum did so with the injection of peptide FOL005, which stands as a derivative to the peptide osteopontin. It seems that they have had minor success in this route, which has led Follicum to come up with a topical peptide gel that, so far, seems to be somewhat promising. Although I must admit I am slightly discouraged by Follicum's poor marketing and deceptive fear-mongering against finasteride and other treatments. Also, they've resorted to taking the cosmetic route. So, not saying that it won't work, but definitely be on the lookout. Secondly, Amplifica is currently in the process of injecting human subjects with potentially a derivative of either osteopontin or osteopontin itself. I talked to Dr. William Rassmann, a co-founder and chief medical officer leading the clinical trial at Amplifica. Furthermore, Professor Maxim Plikus, another co-founder of Amplifica and the chief scientific officer at Amplifica, mentioned the potential for injections of this peptide potential service, the purpose similar to Botox, where every 6 months people would go into a clinic in order to receive injections of their peptide growth stimulant. These injections, for what it's worth, have worked so far in mice test subjects. However, I think we'll see some promise in the human clinical trials. I'm going to add some media right now, just so I can further inform you guys about the exciting work that Amplifica is doing. So I'll be leaving you here with a video about Dr. Plikas's words regarding osteopontin injections, as well as the audio interview I did with Dr. William Rassman. So be sure to check the timestamps in the description to skip this part if you would like to. And if you're watching this live, well, please bear with me. But there is a particular challenge here, and that challenge is, how can we deliver these peptides, these proteins, to the scalp and to the dormant hair follicles? Well, we can turn our attention to an article written by Melissa Kirby et al. Titled, quote, "Microneedle-Mediated Transdermal Delivery of Protein, Peptide, and Antibody-Based Therapeutics, Current Status, and Future Considerations," unquote. And here, microneedles could revolutionize the delivery of therapeutic proteins and peptides. By piercing the skin's outer layer, microneedles facilitate the delivery of large molecules directly into the dermis. And if we go back and reference that article in Wired, Dr. Maxim Plikas is the subject of, along with his research at Amplifica, Dr. Plikas envisions treatments involving microneedling or injection of these proteins, potentially offered biannually. So you would come into a clinic probably 2 times a year and get a scoop 3 or a osteopontin injection to your scalp, and that would stimulate the hair to grow again. And he makes the comparison to Botox treatment. And again, these sorts of injections are very minimally invasive, and they're both cosmetic. Now, you may be asking, why can't we just apply like a liquid form of scoop 3 or osteopontin like we do with minoxidil? But there are some things you have to consider, right? And this is the size of the molecule. There's this fuzzy rule that's generally accepted in dermatology called the 500 Dalton rule. So molecules under 500 Dalton typically have an easier time going through the skin, but as you get above 500 Dalton, you have to do things like increase the concentration of the molecule in a specific solution, play with the lipophilicity of the molecule and its carrier, or what the molecule is being contained in order to penetrate into the skin. But again, this far outshines the issue of it being above 500 Daltons, because it's not just simply a bit above 500 Daltons. The molecular size of scoop 3 is about 109,000 Daltons, right? Something like minoxidil is at 209 Daltons, so that's pretty small compared to scoop 3. And osteopontin is like 44,000 Dalton. So again, the preferred mechanism is probably just injecting it into the scalp, or having some sort of specialized microneedle that can penetrate the skin and deliver proteins and peptides like scoop 3 and osteopontin. Now again, I want to turn my attention back to the Kirby et al. Article concerning microneedle-mediated transdermal delivery of the protein and peptides. I think that it's possible to have some sort of future design that could feature microneedles coated with a gel-like substance containing scoop 3 or osteopontin, or really whatever large molecule. So essentially, it would be like this. Maybe you have a special microneedle, and then you go to the store, you buy this gel tip of scoop 3, you put it on your microneedle, and then you kind of stamp it onto your scalp in areas that you want hair to grow again. And if you're completely bald, it'd probably be the entirety of the scalp or segmented portions of the scalp, right? And this approach aims to control the release rate and improve the stability of these protein, maximizing their therapeutic potential for hair growth. Your view was about the changing technology and how it could improve hair transplant procedures, but
let me tell you another piece, because you're probably going to talk to me a bit about Amplifica. Did you?
Oh, that was, you're beating me to it, but yeah, I mean, I have so many questions about Amplifica, but I was trying to like ease into it, but by all means, yeah, you could proceed. I'm happy to hear about scoop 3, osteopontin, and what the research in the pipeline at Amplifica, like what's actually going on, because so many people are interested in hair growth stimulants and what it could potentially do for them.
Yeah. Well, if you take a look at everything that's been done to date, the real the last drug to hit the market, the last time anything really significant happened was the introduction of finasteride in about mid 1990s. Okay, and since then there has been no breakthrough on the market at all. So there's a man, and it's an important story. A young man who comes to my office looking for a job, and he's 19 years old. And he's an immigrant from Belarus. Okay?
Yeah.
He speaks English, okay. And he says, "Can I have a job working for you?" And I said, "Sure." And I gave him a job as a technician. And we trained him as a technician, but he picked it up real fast. And then shortly after that, he left me and went to college, and then finished with his PhD at University of California, Irvine. And then he went off on a fellowship to the University of Pennsylvania with one of the great men in hair. And then he comes back and becomes the kind of the associate chair of that department at UCI. And he starts applying for grants, and all of his ideas get funded very quickly by the government funding. So all of a sudden he's pulling in a lot of money. And he came up with this clever idea. He says, he looks at these people who have hairy moles. You ever see a hairy mole on a person?
Yeah.
A little black mole, and they got a bunch of hair growing out there, and you have to cut the hair because it grows as long as your head hair. Okay. Okay, so he says, now there's something wrong here. He says, that mole shouldn't be growing scalp hair. So he says, there must be something unique. So what he did is he took the mole, ground it up, a human mole, and ground it up, and then he ran it through a machine called mass spectrometry. And he identified all the proteins that were there in the mole. And he identified hundreds of unique proteins. And then he skimmed those down to the top 20. And then he skimmed them down to the top 5. And all of a sudden, we had drug candidates that needed to be tested. So I helped work with him a little bit at the University of California, Irvine. And we used human grafts. We got patients to volunteer to give up some grafts from their head. And we would transplant them in mice. And we would then set up two sets of controls. These were hairless mice, and one control would have an injection of some medication or saline, and the other one would have an injection of, let's say, osteopontin, one of the drugs you're talking about. And lo and behold, the one that got the injection of osteopontin within 3 weeks grew hair. The other one didn't do anything. And we kept doing this over and over again. And we saw that our model worked very nicely. And since then, we formed a company. He and I and one of our patients formed a company, invested enough money to get it started. And then we raised about $12 million last year. And,
oh, wow.
And now we have multiple drugs in the pipeline. The first one is going through clinical trials right now. They'll be out probably August, September. So I'm the medical director of that company, and I would love to see the results, but I'm not allowed to have access.
Yeah. Oh, wait, sorry. So if I am to cut in real quick, there is a current clinical trial ongoing right now.
Correct.
Okay, wow. That's really cool. And we can expect results sometime this summer? I'm just trying to...
Well, we'll get results. I mean, keeping in mind there are a lot of things. We're paving a lot of new ground here.
Yeah.
The drug is going to be, at this stage, is an injectable, something people would not want. Okay, so the first thing to do is to prove that the drug works, or the proteins that we're putting in as a stimulus. This is a very different approach, because what this does, it literally kicks a hair follicle and makes it grow. It just activates the hair follicle. And it doesn't have all the other effects. And we expect that this drug will have minimal side effects. And we'll see whether it works in the patients that are being tested right now. But we have 5 drugs that will go into the pipeline. And I really don't know what the results are yet.
Okay, wow, that's really, really interesting. So what are steps, if you can speak on this, what are the particular steps that Amplifica is taking in the event, let's say everything goes well, in the event that some of these compounds are viable? How do we actually get these things marketed, right? Like how does it come to market? Does it go to
Well,
certain clinics?
well, keep in mind, we're not a billion-dollar company. So you need a big pharmaceutical company to step in and take our injectable medicine and turn it into a cream or a pill
I
that
see.
will basically work directly for a patient. And that's a thing they specialize in, we don't. So our job is to invent the drug, to pioneer and prove that the drug works, or it's really a protein, prove that the protein works. And then when that happens, a drug company will step in, and then they'll do their thing to bring it to market. It's a new drug category, which in itself may or may not produce a problem with the FDA. There are two ways of getting approval from the FDA. There is something called a 510K approval process, which is a process where if you did something similar to somebody else and it's almost identical, and it works the same way, they'll give you approval within 90 days. And then there's another one that says if you don't have something that's comparable to that, then you got a 5-year process.
Oh, wow.
Okay, they don't say it's 5 years. They have a different name for it, but I can tell you it takes a big pharmaceutical company with a lot of money. You know, the typical pharmaceutical company spends $1 billion to $1.5 billion to bring a drug to market. So if we have a cure for hair loss or a kicker that will kick the hair to stop growing and really get it going, it's going to take probably 5 years.
I see. So to reiterate, it's the goal of Amplifica to actually prove that some of these, I guess, peptides or molecules are viable, and then from there, a bigger pharmaceutical company would potentially take it.
That they will grow hair under what conditions, what circumstances, and that's our job now, and that's what we're going through, and that's an expensive, tedious process. I did not when I started getting involved with it on the clinical trials. I've never done clinical. This is my first time on clinical trials, and and I can tell you it's a lot more complex than I ever imagined.
Yeah.
It would be. Now from an inventive point of view, if I go back to my history back to many years ago, in 1969 specifically, I came up with a heart pump that would assist the failing heart, and I developed it in the lab and worked out all the details in it, and then I introduced it at an American College of Cardiology meeting in 1900.
So, what about the use of other peptides? So, what about the use of other peptides? If you've been browsing the internet recently, you may have encountered discussions about using peptides as potential hair growth stimulants. These peptides are administered in various ways, either injected locally into the scalp, applied topically, or ingested orally due to their purported benefits for the skin and supposed effects on hair follicles. Unfortunately, many of these peptides have unproven effects when it comes to human use, including claims of regenerative properties. And I'm not just talking about the regeneration of hair follicles and the growth of hair. These claims extend to supposed benefits for joints, muscles, and skeletal issues due to their alleged regenerative effects. All around, some of the peptides are stated to be beneficial for human tissue. Again, much of this stuff is unproven, and this isn't to say that none of them may have benefits, but rather the research seems to be extremely limited, non-existent, and downright contradictory, often not applicable to humans in most cases. Also, when it comes to safety, we need to be careful when using the peptides. Although some are derivatives or exact compounds of things that naturally occur in our bodies, introducing too much of them could be harmful. Also, I would like to note that I'm all for experimenting and trying to see what peptides can do for some individuals. For instance, peptides that may be anti-inflammatory may have some positive effects on scalp skin. I'm going to take a different angle here and perspective when it comes to talking about the scalp. Sometimes we may be a bit too focused when it comes to improving hair growth and hair quality that we seriously forget that our scalps are skin. So I personally don't see any harm in treating the scalp skin just as much as we target the hair follicle environment to reduce DHT. Keeping a clean, healthy, and rejuvenated scalp may help reduce signs of inflammation and thus put hair follicles in a better position of regrowth and recovery after long-term scalp DHT deprivation. So my attention, as you may be able to tell, will be focused on either topical use or injection of these peptides. So where do I possibly start? There are so many peptides that I could sit here and cover, but I'm going to focus on a few that are involved with skin and hair, or at least purported to be involved with skin and hair. These peptides that I will be reviewing are BPC-157, GHK-Cu, KPV, and Thymosin Beta-4, also known as TB500. So up next, we have Body Protection Compound 157, also known as BPC-157. Now, I tried looking through the literature on Google Scholar and various databases to find studies that looked at body protection. Compound 157, also known as BPC-157, for treating androgenetic alopecia or any hair loss conditions in humans. I think the allure of this compound is in its potential to treat damaged tissues and regenerate them. Most of this, however, seems to have been demonstrated on mice. For example, in the study by Guire et al. Titled Gastric Pentadecapeptide Body Protection Compound BPC-157 and its role in accelerating musculoskeletal soft tissue healing, published in 2019, the authors critically review the use of BPC-157 as a potential therapy for healing soft tissue damage with a focus on tendon, ligament, and skeletal muscle healing. The researchers focused on various animal studies, particularly rodent models, that demonstrated the effects of BPC-157 on tissue repair. These studies consistently showed that BPC-157 could accelerate the healing processes in tissues damaged by trauma or disease by mechanisms that include promoting angiogenesis and enhancing the survival and migration of fibroblasts. These cells are crucial for the repair and regeneration of connective tissues and the activation of the FAK-Paxillin pathway, which the review discusses, is essential for cellular movement and attachment, both key to tissue regeneration. Despite these promising results in animal models, the review critically highlights a significant gap: the translation of these findings to human clinical applications. To date, the efficacy and safety of BPC-157 in human subjects remain untested and unconfirmed, which means its clinical use in human tissue healing is still not established. This lack of human trials is a major limitation and an area that the study stresses needs further exploration. Guire and colleagues suggest that future research should not only continue in larger animal models, but also advance into human clinical trials. This step is crucial for determining whether the positive outcomes observed in simpler biological systems can be replicated in the more complex human physiology. The review also notes that much of the research on BPC-157 has been concentrated within a few research groups, which may limit the breadth of the findings and their generalizability. I don't believe that simply applying BPC-157 to the scalp, whether in a topical solution, cream, or through injections, would directly stimulate hair growth or rejuvenate hair follicles. However, it's essential to reflect on the significant breakthrough in scarless healing achieved through the use of YAP inhibitors, particularly Verteporfin, which has garnered attention in the hair transplant community. So, how could Verteporfin and BPC complement each other? Are there any hypothetical synergistic applications of these two compounds? For those needing a refresher, Verteporfin is a drug that can prevent scarring when injected at the edge of a wound. This drug, already FDA approved for treating macular degeneration, works by blocking engrailed-1 N1 activation in fibroblasts, thereby inhibiting scar formation. The groundbreaking research on Verteporfin's role in scar prevention was led by Stanford MD PhD student Shamek Mashtarak and his team, as detailed in their study titled Preventing Engrailed-1 Activation in Fibroblasts Yield Wound Regeneration Without Scarring. In their study, the researchers injected Verteporfin to surgical wounds in mice while simultaneously applying mechanical strain to the healing tissues. The results were remarkable, with the healed skin appearing completely normal, devoid of the dense fibrotic scarring typically seen in wound healing. This discovery underscores the potential of Verteporfin not only in preventing scarring, but also in promoting regenerative healing processes that could have profound implications for various medical fields, including hair transplantation. Moreover, the paper Inhibiting Yes-Associated Protein prevents scarring and promotes regeneration in a large animal model of wound repair. Heather E. Talbot and colleagues demonstrated that a single local administration of verteporfin following injury significantly reduced scarring and induced regenerative healing in red Duroc pigs. Notably, these pigs are a close analog to human skin in terms of thickness and are often used in dermatological research, making the findings particularly relevant. The successful regeneration of scarless skin and hair follicles in these pigs points to the potential of verteporfin to prevent scarring and regenerate hair follicles in humans as well. You see, mammals, including humans, primarily heal through a process that results in scarring. When an injury occurs, the body's immediate response is to close the wound, prevent infection, and restore integrity to the area. This involves a complex cascade of inflammatory responses, tissue formation, and remodeling, often resulting in scar tissue, which is fibrous and lacks the original tissue's full functionality and appearance. The scarring process is quick and effective for survival, but does not restore the original tissue's architecture. In contrast, some species, such as certain amphibians and reptiles, can regenerate lost limbs or organs. This regeneration involves the regrowth of complex structures, including bone, muscle, and skin, to fully restore the lost parts' function and appearance. For example, axolotls can regenerate entire limbs, tail, heart, and other organs with perfect functionality and without scarring. The process involves dedifferentiation of cells, proliferation, and redifferentiation, meticulously reconstructing the lost part. When we look at early fetal development in the context of humans, human fetuses have the ability to heal wounds without scarring. This is observed in the unique regenerative capacity of fetal skin, which can completely regenerate without scar formation until a certain point in gestation. The environment within the womb, including high hydration and specific growth factors, along with a distinct cellular response, allows for this scarless healing. Yes-associated protein, or YAP, is a key regulator within the Hippo signaling pathway, crucial for controlling organ size, cell proliferation, and apoptosis. It's also significantly involved in wound healing and tissue regeneration. As we have explored in the previous studies, YAP influences the behavior of fibroblasts such that when it is active, fibroblasts are more likely to create the fibrous, collagen-rich tissue that leads to scars. Blocking YAP would reduce this scarring tendency and encourage a more regenerative form of healing. Given what we have learned from the descriptions of animal models by Guire et al., BPC-157 could be worth exploring for tissue repair in hair transplants. During a hair transplant, scars are created by proxy when surgeons extract hair from the donor area. While verteporfin may slow down YAP signaling and reduce the formation of scar tissue, there might still be a need for an agent that can promote proper tissue repair and bring the tissue to a state of normalcy and stability. BPC-157, another peptide, or possibly a combination of peptides, could fulfill this role. Hair transplant physicians would need to develop a standardized methodology for administering these peptide injections to the donor area. They would also need to conduct detailed studies to understand what factors could influence the healing process. Also, any progress that is made here would have profound impacts to not only the world of dermatology, but regenerative medicine as a whole. You see, scar formation plays a crucial role in many diseases affecting the human body, as it involves the repair of tissue, not just the visible skin that we see. Scarring or fibrosis can form within internal tissues like your lungs or your liver, impacting the connective structures and organs that support various bodily functions. So, all in all, BPC 157 or 157 doesn't seem to have direct hair growth benefits, so I wouldn't rank this as a promising peptide for topical use, injectable use on the scalp, or to be honest, even oral use. And be very careful of these oral supplements because sometimes you're not even sure what you're getting and it could have some other risky impurities inside of them as well. So be very careful. Don't play with these kinds of things. And if you are to source it out, it would be better to go to a legitimate pharmacy or at least consult with a medical practitioner. So now, up next, we have GHK-Cu, the copper peptide, and yeah, let's see what's going on with this peptide and let's get started. Copper peptides are small protein fragments that have a strong affinity for copper ions, essential trace elements involved in many enzymatic processes in the body. These peptides bind copper ions, making them bioavailable and helping to transport them to various tissues. In this case, copper peptides like GHK-Cu or glycyl L-histidyl L-lysine copper are a naturally occurring copper peptide found in human plasma, saliva, and urine. This small molecule consists of 3 amino acids, which include glycine, histidine, and lysine. These amino acids are bound to a copper ion. Now, a quick look at the medical literature will show you that GHK exhibits potent antioxidant properties and may also protect the human organism's skin from damage caused by free radicals and environmental stressors, helping to prevent premature aging and skin degradation. A good starting point into understanding GHK is the article GHK and DNA, Resetting the Human Genome to Health by Lauren Pickart et al. This paper provides a comprehensive overview of GHK's multifaceted role in promoting health and combating aging by modulating gene expression. When we read the review, we are to understand that the antioxidant properties of GHK are crucial for maintaining the body's overall health and in combating the effects of aging by upregulating 14 antioxidant genes and suppressing 2 proxidant genes. GHK in theory can help bring balance to the body's oxidative stress levels. And it should be noted that oxidative stress occurs when there's an imbalance between free radicals. And these are unstable molecules that can damage cells. The body typically has ways of neutralizing them with antioxidants properties. However, over time, high levels of oxidative stress dysregulate the body, and eventually the natural defenses begin to fail. In our modern day, we are exposed to so many environmental stressors that I can only imagine that what we are naturally equipped with to combat the free radicals cannot keep up. This can lead to cell damage, which aside from contributing to normal aging, this process of high exposure to oxidative stress ultimately leads to earlier aging and the development of chronic diseases such as heart disease, cancer, and neurodegenerative disorders. One of the important genes influenced by GHK is transducin-like enhancer 1, or typically referred to as TLE1, which inhibits the inflammatory gene called nuclear factor, kappa light chain enhancer of activated B cells, also known as NF-kappa B. NF-kappa B plays a key role in the body's response to stress and inflammation. When overactive, NF-kappa B can contribute to chronic inflammation, a condition linked to many age-related diseases. By enhancing TLE1, GHK helps to keep inflammation in check, thereby protecting tissues from damage and supporting overall health. Furthermore, GHK activates SPRR2C, a gene that protects DNA from oxidative damage. We all know that DNA is the blueprint for all cellular functions, and its integrity is crucial for maintaining healthy cell function and preventing mutations that could lead to cancer. By safeguarding DNA, GHK has the potential to preserve the genetic instructions necessary for the body's normal operations and longevity. So GHK seems to have a lot of benefits that have mostly been noted in vitro animal models as detailed in Pickart et al.'s review. So let's have a quick rundown of these studies that explore the efficacy of GHK in reducing inflammation and enhancing wound healing. Now, remember, all of this could have indirect benefits to scalp skin health, but also potentially in skin regeneration techniques that could be used to amplify the results of verteporfin in skin healing after a hair transplant. If the donor area is healed successfully such that skin structures and follicles are regenerated, then this is a major win for those suffering from extreme hair loss, because we are essentially manipulating our body's healing process to what is essentially clone new hair follicle. So I want to be optimistic here with these peptides, but also let you guys know now that yes, most of these studies that you'll ever find in the literature are animal models, tissue models, or single cells. I've found 5 studies that I think present detailed insights into their therapeutic potential across various models. In the study, quote, evaluation of the effects of topical tripeptide copper complex and zinc oxide on open wound healing in rabbits, unquote, conducted by Kangul et al. a detailed experimental setup was designed to investigate the effects of GHK on wound healing compared to zinc oxide and a control group receiving no treatment. This study was set in a controlled environment where each rabbit was treated under the same conditions to ensure consistency and reliability of the results. The study involved creating similar-sized open wounds on the rabbits, which were then treated with either the GHK complex, zinc oxide, or left untreated. The researchers applied the treatments immediately after wounding and subsequently at regular intervals. The primary metrics for assessing the efficacy of the treatments included measuring the rate of wound contraction and the formation of granulation tissue, which are critical markers of the wound healing process. Over the course of 21 days, detailed observations were recorded. Wound contraction was measured in terms of the percentage decrease in wound size, which is a direct indicator of how quickly the wound is closing. Granulation tissue, which is new connective tissue and microscopic blood vessels that form on the surfaces of a wound during the healing process, was assessed for its quantity and quality. The presence of granulation tissue is crucial as it provides the foundation for wound healing by replacing the extracellular matrix and restoring vascular integrity. The results from this study showed that wounds treated with GHK exhibited a significantly faster rate of contraction compared to those treated with zinc oxide and the untreated group. This accelerated wound contraction in the GHK-treated wounds suggests that GHK not only promotes quicker closing of the wound, but may also enhance the cellular processes involved in healing. Furthermore, the formation of granulation tissue was notably more robust and appeared quicker in the GHK group. This is indicative of an enhanced inflammatory response, which is essential in the early phase of wound healing, leading to quicker tissue regeneration and repair. The quality of granulation tissue observed in the GHK-treated wounds was superior, with a denser network of new blood vessels and connective tissue, which are vital for supplying nutrients and oxygen necessary for healing. In the study conducted by Gould et al., titled The Effects of Topical Tripeptide Copper Complex and Helium Neon Laser on Wound Healing in Rabbits, a comprehensive approach was used to assess the synergistic effects of GHK and varying intensities of low-level laser therapy on wound healing. This research is particularly significant as it explores not only the chemical but also the physical stimulation of wound healing processes, providing a comparative analysis of these methodologies. The study involved several groups of rabbits, each receiving a different treatment modality. These included a control group, a group treated with GHK, another with low-dose helium neon laser therapy, and a final group receiving high-dose laser therapy. The GHK and laser treatments were applied to standardized open wounds created on the rabbits, with meticulous care to maintain consistency in wound size and treatment application. The primary endpoints for evaluation included the rate of wound closure, the quality of newly formed tissue, and the overall speed of the healing process. Wound closure was quantitatively measured by tracking the reduction in wound surface area over time, providing clear data on the speed at which the wound's size decreased. The quality of tissue was assessed through histological examinations, looking at the density and arrangement of collagen fibers, the formation of granulation tissue, and the degree of epithelialization. Findings from the study revealed that both high-dose laser therapy and GHK treatments significantly accelerated wound closure compared to both the control and the low-dose laser groups. The high-dose laser group showed a rapid response in the initial stages of healing, which is characteristic of the photobiomodulation effects of low-level laser therapy. These effects include enhanced cellular metabolism, increased circulation, and anti-inflammatory responses, which collectively contribute to faster wound closure. Similarly, the GHK treatment demonstrated notable efficacy in enhancing the quality of granulation tissue. The granulation tissue in GHK-treated wounds was richer in collagen and exhibited a more organized structure, indicating a robust healing response. This improvement in tissue quality is crucial, as granulation tissue is the precursor to the new skin that forms during the healing process. Better quality granulation tissue not only supports quicker wound closure, but also results in stronger, less scar-prone healed skin. Moreover, GHK was shown to have an anti-inflammatory effect, crucial for managing the cellular environment of healing wounds. Inflammation, if prolonged, can impede healing and lead to chronic wound conditions. By modulating this response, GHK aids in creating an optimal healing environment, which complements the physical stimulation provided by laser therapy. The study conducted by Arul et al., titled A Therapeutic Approach for Diabetic Wound Healing Using Biotinylated GHK-Incorporated Collagen Matrices, explores the therapeutic potential of a novel formulation designed specifically for the complexities associated with diabetic wound healing. Diabetic wounds are notoriously difficult to manage due to impaired inflammatory responses, reduced growth factor production, and compromised angiogenesis. These wounds often exhibit prolonged healing times and increased susceptibility to infections, necessitating innovative approaches to treatment. The research by Arul et al. Focuses on the integration of a tripeptide, GHK, which is biotinylated and then embedded within collagen matrices. By biotinylating GHK, the researchers aim to enhance its stability and efficacy within the wound environment, allowing for sustained activity over prolonged periods. The experimental setup involved two primary groups of diabetic rats, one treated with the biotinylated GHK collagen matrices and a control group treated with standard collagen films without the GHK modification. The wounds were inflicted in a standardized manner across all subjects to ensure consistency in the assessment of the healing process. Key metrics evaluated in the study included the rate of wound contraction, levels of various antioxidants in the wound tissue, and the quality and quantity of collagen deposition. Wound contraction serves as a primary indicator of healing progress, reflecting the ability of the wound to close over time. Antioxidant levels are critical as they help mitigate oxidative stress, a prevalent issue in diabetic wounds that can exacerbate inflammation and delay healing. Collagen deposition is another crucial factor, as it strengthens the newly formed tissue and supports overall wound integrity. The results demonstrated that wounds treated with biotinylated GHK collagen matrices showed significantly faster contraction compared to those treated with standard collagen films. This suggests that GHK not only enhances the intrinsic properties of collagen, but also actively stimulates tissue repair mechanisms specific to the diabetic environment. Moreover, the treated groups exhibited increased levels of antioxidants such as superoxide, dismutase, and glutathione. These antioxidants play a vital role in reducing oxidative stress at the wound site, promoting a healthier healing environment, and potentially offsetting some of the systemic effects of diabetes that complicate wound repair. The fourth study, stimulation of collagen synthesis in fibroblast cultures by the tripeptide copper complex glycol L-histidyl L-lysine Q2+ by McCourt et al., examines GHK's impact at the cellular level. This study employs human fibroblast cultures to observe collagen synthesis stimulation by GHK without affecting cell proliferation. The detailed examination of protein synthesis within these cultures illustrates that GHK significantly promotes collagen production, a crucial component of tissue repair, thereby supporting wound healing and potential reduction in inflammation through enhanced tissue structure formation. Lastly, the study by Matalka et al., titled The Tripeptide GHK Induces Programmed Cell Death in SHSY5Y Neuroblastoma Cells, explores another dimension of GHK's functionality. While primarily focusing on GHK's ability to induce apoptosis in cancer cells, this study also highlights its role in stimulating the growth of healthy human NIH3-T3 fibroblasts. This aspect is particularly relevant as it underscores GHK's selective bifunctionality, promoting growth where beneficial while inhibiting and inducing apoptosis in malignant cells, thereby supporting its potential as a therapeutic agent in wound healing and cancer treatment. Each study, through its unique focus and methodology, reinforces the potential of GHK as a potent agent for reducing inflammation and enhancing wound healing across different biological models and setups. The consistent findings across diverse experimental frameworks suggest that GHK could be a valuable therapeutic tool in both clinical and veterinary settings. However, further investigations into the molecular mechanisms of GHK action will be essential to fully harness its therapeutic potential and ensure its efficacy and safety in broader clinical applications. Now, even with all of this being said, there is still no evidence to show that using copper peptides like GHK helps regrow hair follicles or stimulate the growth of new hair, especially with topical application. However, I'm not going to say it is useless. Like I mentioned in a previous section, the scalp skin is still skin. Treating the skin and taking steps to ensure the environment is free from inflammatory issues and is well moisturized could help promote an environment on the scalp that is conducive to hair growth and reducing hair breakage. I can see GHK being used on the scalp to help maintain the scalp skin in a somewhat balanced and healthy state where inflammation is potentially kept in check. However, if you have a copper allergy, it's probably better to avoid using the peptide. As with many treatments, test it on your arm away from your scalp or seek advice and assistance from a dermatologist. Doctors are very important here. I think this part is pretty important, so now we're going to talk about copper peptides and the Alzheimer's disease connection, because just in case, we want to cover our bases here before anyone even looks to using these peptides, especially taking it orally. I don't take these things orally, and I've never used these peptides before, but one thing I probably wouldn't do would be the oral exposure, so let's just get into it. Copper peptides, Alzheimer's disease connection. Also, on a more personal note, I don't think I would ever take GHK orally. There's some evidence that shows that copper peptides may be implicated in Alzheimer's disease. I won't get into it in this video, but check out the paper titled, quote, "Role of Copper in the Onset of Alzheimer's Disease Compared to Other Metals," unquote, by Bagheri et al., where this is discussed. For a short summary, researchers note that copper ions are found in high concentrations within amyloid plaques. Amyloid plaque buildup in the brain is what causes Alzheimer's disease. Now, there appears to be some sort of contradiction here, as copper seems to have both protective and pathogenic effects depending on its levels and binding states. Some studies suggest that copper deficiency could contribute to Alzheimer's disease by impairing neuronal function and enhancing amyloid plaque formation. A reduced level of copper in the brain has been associated with increased amyloid precursor protein processing along the amyloidogenic pathway, promoting beta amyloid production. Conversely, other studies indicate that excessive copper in the brain can enhance beta amyloid aggregation and toxicity. Copper binds to beta amyloid with high affinity, promoting its aggregation into plaques and facilitating the production of reactive oxygen species, which can damage neurons. I'd like to be careful and not risk things, but taking a more nuanced view suggests that Alzheimer's disease involves an imbalance in copper homeostasis with increased labile or unbound copper in the brain and decreased copper bound to proteins. This condition, as the researchers cite, resembles Wilson's disease, where disrupted copper regulation leads to toxicity. So, less copper than usual and more than usual could lead to amyloid plaque buildup in the brain and cause Alzheimer's disease. Certainly, this ratio may vary by individual. Now, I would like to return back to a hair loss context. I think I've been on this segment about GHK-Cu for a bit too long now, but we'll finish up with this one review article by Lauren Pickart. The review paper titled "The Human Tripeptide GHK and Tissue Remodeling" by Lauren Pickart extensively discusses the versatile role of the peptide GHK, especially its complex with copper, GHK-Cu, in promoting tissue remodeling and healing across a variety of models. GHK-Cu has been identified as a potent facilitator of wound healing processes, including the activation of skin remodeling, anti-inflammatory actions, and stimulation of collagen production, among other benefits. One of the significant aspects covered in the paper is the effect of GHK-Cu on hair growth. Pickart notes that GHK-Cu has been observed to enlarge hair follicles and stimulate hair growth in rodent animal models. This was especially evident in peripheral areas of wounds treated with GHK-Cu, where there was notable hair follicle enlargement. These observations have led to the development and use of GHK-Cu in treatments aimed at enhancing hair growth and improving the success of hair transplants. Now, you can already see where I'm going with this, again, and this would be the encouragement of using Verteporfin, GHK-Cu, and possibly BPC-157 in the wounds that are created in the donor area, which hopefully would give improved chances of amplifying the number of follicles in our donor area. Now, Pickart actually mentions a GHK analog that has been used for post-care after a hair transplant. Pickart notes that GHK analogs with added hydrophobic amino acid residues have been used commercially in a product known as Graphsite. There have been some small-scale clinical studies cited in the review indicating that these GHK analogs can reduce crusting times in post-transplant scenarios and decrease the shedding of transplanted hair. Additionally, they appear to accelerate the regrowth of new hair. Like with many of these small-scale cosmetic studies, there isn't much to reliably say that it works. But it wouldn't hurt to give it a try. Overall, the review by Picard effectively highlights the broad potential of GHK-Cu in medical applications, particularly in enhancing skin repair, anti-aging treatments, and improving hair transplant outcomes through its multiple biological actions that support tissue repair and regeneration. So my honest opinion is that GHK-Cu may help promote a healthier skin environment so long as you aren't allergic to copper peptides. I think it also has a strong case for wound recovery and healing. However, there isn't that much strong evidence as GHK-Cu being a comparable growth stimulant to minoxidil, at least when it comes to humans, so don't be scammed by these new companies like Flava or Flava, whatever their name is. Don't be scammed by them because there is no evidence in the literature that shows GHK-Cu promoting or stimulating hair growth. That's not there, especially in the same way to minoxidil. Also, a quick point, when you look at Flava's website, again, whatever their name is, however you pronounce it, there are some weird things to them. I would encourage people to actually, do some quick Google searches on the particular images, because some of it comes from different forms that essentially there's no way that these people would have used Flava because those pictures predated Flava's operations. But yeah, it's mostly fake when it comes to these claims that it's going to grow hair. So that's just me jumping in the post-edit. I just want to tell people that please don't use these random, unproven, hair growth stimulants or whatever. So now up next we have KPV, or lysine proline valine, also known as KPV, or I think LPV sometimes. Lysine proline valine, abbreviated as KPV, is a small peptide composed of the amino acids lysine, proline, and valine. Some of these amino acids are naturally occurring in the body and can be obtained through dietary intake. For instance, lysine is an essential amino acid that must be consumed in diet, while proline and valine can be synthesized by the body and are also found in various protein-rich foods. Despite the presence of these amino acids in the body and through diet, the specific structure of the KPV peptide matters because it combines these amino acids in a sequence that confers unique biological activities. You see, when amino acids form peptides, their functions can change significantly compared to when they are present individually. In the case of KPV, this particular combination exhibits anti-inflammatory properties that aren't necessarily seen with the amino acids alone. Now, it seems like recently on the internet that KPV is gaining attention for its potential benefits for not only skin health, but also hair health, particularly in addressing conditions like hair loss and androgenetic alopecia. However, none of this information is new. In fact, I noticed a trend among some novel peptides and how some of them either have their use case patented or the peptide itself patented. I saw a similar instance with Amplifica's osteopontin injection protocol for hair growth stimulation and rejuvenation. So I decided to do some quick digging to see if the same would be true with KPV and hair loss. And it didn't matter for me which kind of hair loss, because I mostly wanted to see if KPV was even used in that domain. But to my surprise and amazement, it turns out there was a patent that involved KPV and treating androgenetic alopecia, and it was filed by none other than L'Oreal. So, let's take a look. United States patent number 6,001,812, titled, quote, Modulating Body Cranial Hair Growth with Derivatives of the C-type melanocyte Stimulating Hormone, unquote, was granted to inventor Jan Mahe and is assigned to Société L'Oréal S.A. The patent was filed on January 23, 1998, and was officially issued on December 14, 1999. This patent, which has since expired, presents a significant advancement in the field of hair growth regulation. The core innovation of this patent lies in the discovery that peptide sequence contains the lysine proline valine, also known as KPV, or their functional biological equivalents can be effectively used to stimulate or induce the growth of body and cranial hair. These peptides, derived from or mimicking the C-type melanocyte stimulating hormone, also known as CMSH, are described as potent agents in promoting hair growth and preventing hair loss. The CMSH is a neuropeptide known for its various roles, including its anti-inflammatory and pigmentation-promoting activities, and is naturally present in the human body. The patent outlines that these peptides, specifically those excluding sequences where lysine proline valine is immediately preceded by a histidine residue, can extend the anagen phase of the hair cycle. The anagen phase is the active growth phase, where the hair follicle is producing new cells, resulting in hair elongation. By prolonging this phase, the peptides effectively delay the transition to the telogen resting phase, thereby reducing the frequency of hair loss cycles and promoting a fuller head of hair. In detailing the composition and application, the patent covers a range of formulations that incorporate these peptides. These can be used in various forms, including topically applied gels, creams, and sprays, which are designed to be administered directly to the scalp or other areas of the body where hair growth is desired. It is also noted that the peptide may be of natural or synthetic origin, and their efficacy is enhanced by modifying their chemical structure to include protective groups such as acylation or acetylation at the amino terminal end, or amidation at the carboxy terminal end. This would help with the peptide's integrity and dermal penetration. Now, the application of these peptides in hair growth compositions is broad. The patent mentions how KPV may be useful for treating various types of alopecia, including androgenetic alopecia, which is characterized by a progressive thinning of the hair and is commonly seen in genetically predisposed individuals. The patent also suggests that these peptides could be beneficial in managing other hair disorders, including those with an inflammatory component. Inflammatory stages of alopecia are marked by elevated levels of mediators such as cytokines and prostaglandins, which the peptides can help regulate, thus mitigating hair loss and promoting regrowth. Beyond the specific KPV sequence, the patent also explores the potential of using these peptides in combination with other known hair growth agents. These include minoxidil, a well-known hair growth stimulant, and various anti-inflammatory compounds, anti-androgens, and other biologically active substances that can further enhance the hair growth promoting effects of the peptides. So this peptide, at one point in time, seemed to have some promise as both an anti-inflammatory and hair growth stimulant. I think this speaks to my earlier point about focusing on the scalp skin health rather than directly on the hair follicle. With that being said, there must be studies done that involve KPV and the treatment of dermatological conditions based in inflammation and perhaps in hair loss. My attention is exclusively focused on androgenetic alopecia. However, any dermatological condition and its improvement would be beneficial to the potential use of KPV topically on the scalp. Studies have shown that KPV can effectively reduce inflammation, which is a key factor in many skin conditions. The paper titled, quote, Transdermal iontophoretic delivery of lysine proline valine, also known as KPV, peptide across microporated human skin, unquote, by Kasturi Pawa et al., investigates the delivery mechanisms of the KPV peptide, a tripeptide with notable anti-inflammatory properties derived from alpha melanocyte stimulating hormone. The study's primary focus is on enhancing the transdermal delivery of KPV through iontophoresis, microneedling, and their combination using human cadaver skin as the model. The overarching goal is to overcome the challenges of KPV's hydrophilicity and limited skin penetration for potential therapeutic applications in inflammatory skin conditions. Now, in previous sections, we talked about how some of the issues involving the use of peptides involve its molecular size as well as hydrophilic nature. Human skin is one that is made up of fat and generally limits the penetration of molecules above 500 Dalton. Approaching this Dalton size, along with not being lipophilic, makes it very unlikely that peptides may be effectively used as growth stimulants if merely applied on the scalp. Usually, injections are an alternative and cheap method to see if a peptide will have derma effects. This gives KPV and many other peptides some serious issues when it comes to penetrating the skin. So, methods of effective drug delivery must be utilized. In this study, the researchers utilized in vitro methods to evaluate various transdermal enhancement strategies. Human cadaver skin was harvested, dermatomed, and preserved before being used in vertical fronts diffusion cells to simulate transdermal delivery conditions. The KPV peptide's small molecular weight and hydrophilic nature posed significant barriers to passive diffusion across the skin. To address this, the study explored the effects of iontophoresis, microneedling, and their synergistic combination on KPV's permeation and retention in the skin. Iontophoresis involves using a small electric current to drive charged molecules through the skin. Given that KPV has a positive charge at physiological pH, the researchers employed a nodal iontophoresis to enhance its transdermal delivery. They varied the current strength, duration of current application, and KPV concentration to optimize delivery. The study found that increasing the current density up to 0.5 mA per square centimeter significantly enhanced KPV permeation through the skin. However, further increases in current did not proportionally increase permeation, suggesting a potential plateau effect due to limitations in the skin's ability to conduct higher currents without causing irritation or damage. Microneedling, on the other hand, involves creating microchannels in the skin using fine needles, which can reduce the barrier function of the stratum corneum and enhance the delivery of large and hydrophilic molecules. The researchers used a dermaroller device to create these channels, making 20 passes over the skin to ensure consistent microchannel formation. The combination of microneedling with iontophoresis was particularly effective, showing a synergistic effect in enhancing KPV permeation. The study reported that this combination increased the permeation rate by approximately 35-fold compared to microneedling alone, and significantly more than iontophoresis alone. Additionally, the researchers assessed the skin retention of KPV using confocal microscopy, which allowed them to visualize the penetration of a fluorescently labeled KPV conjugate through the skin layers. They observed that while passive diffusion resulted in negligible penetration beyond the stratum corneum, both iontophoresis and microneedling facilitated deeper penetration. The combination of these methods led to substantial KPV retention in the lower epidermal layers, demonstrating the effectiveness of the combined approach. The study's findings show that there is some potential of KPV as a topical anti-inflammatory agent, particularly when combined with advanced delivery techniques like iontophoresis and microneedling. The enhanced delivery and retention of KPV in the skin achieved through these methods could translate into improved therapeutic outcomes for treating inflammatory skin disorders without the side effects associated with traditional corticosteroid treatments. So, to conclude here, the study demonstrated that KPV could significantly diminish inflammatory responses in the human cadaver skin. Of course, we aren't dead yet, and the dead shouldn't really be worrying about skin care all too much. That's over and done with. But it is human skin nevertheless, and the researchers went through extensive measures to ensure its integrity. It may not be a perfect in vivo study, but it shows that KPV does have some promise. After all, why would L'Oreal patent it? So now let's get into the inflammatory aspects of different hair loss conditions. The study's titled The Inflammatory Aspect of Male and Female Pattern Hair Loss by Nadia Paravian et al. And Fibrosing Alopecia in a Pattern Distribution, Patterned Lichen Planopilaris or Androgenetic Alopecia with a Lichenoid Tissue Reaction Pattern by Martin S. Zinkernagel et al. Offer deep insights into the inflammatory mechanisms underlying different types of hair loss. In the study by Nadia Paravian and her colleagues titled The Inflammatory Aspect of Male and Female Pattern Hair Loss, the authors examined the role of inflammation in male and female pattern hair loss. These types of hair loss affect millions of people and are commonly known as male pattern baldness and female pattern baldness. Traditionally, these conditions are attributed to the miniaturization of hair follicles and alterations in the hair growth cycle. However, Paravian and her team present compelling evidence that Inflammation is also a significant factor in these conditions. They document the presence of inflammatory cells, such as lymphocytes and histiocytes, around the hair follicles in affected individuals. Additionally, they highlight the involvement of inflammatory genes, including Casp7 and TNF. The study suggests that addressing the inflammatory aspect of male and female pattern hair loss could lead to more effective treatments, as current options like minoxidil and finasteride offer only partial regrowth and limited efficacy. On the other hand, Martin S. Zinkernagel and his co-author Ralph M. Trube, in their study Fibrosing Alopecia in a Pattern Distribution, patterned lichen planopilaris or androgenetic alopecia with a lichenoid tissue reaction pattern, focus on a subset of patients with a scarring form of hair loss. This condition observed in 19 patients. The breakdown between genders was 15 women and 4 men, all featuring progressive hair loss in a pattern similar to androgenetic alopecia, but with significant inflammatory and fibrotic characteristics. The study reveals that these patients display both the miniaturization of hair follicles typical of androgenetic alopecia and the inflammatory feature seen in lichen planopilaris. The authors describe how these patients exhibit symptoms like parafollicular erythema, follicular keratosis, and a loss of follicular openings confined to the areas affected by hair loss. Histologically, the early stages of this condition show a lichenoid inflammatory infiltrate around the upper regions of hair follicles, while advanced stages involve extensive fibrosis and destruction of follicles, similar to lichen planopilaris and pseudopelade of Brock. Comparing the two studies, both emphasize the critical role of inflammation in hair loss, but from different perspectives. The study by Paravian et al. Focuses on non-scarring forms of hair loss, specifically male and female pattern hair loss, and suggests that inflammation contributes significantly to their pathogenesis. They propose that future treatments should address this inflammatory component to enhance efficacy. Conversely, the study by Zinkernagel et al. Explores a condition that intersects between non-scarring and scarring hair loss, showing that some patients with androgenetic alopecia also present with inflammatory and fibrotic changes characteristic of scarring conditions like lichen planopilaris. This study underlines the importance of distinguishing this form of scarring alopecia from traditional androgenetic alopecia for better management and therapeutic strategies. Given the observed potential effects of KPV and its anti-inflammatory properties, it could be used to treat conditions like lichen planopilaris and the inflammatory aspects of androgenetic alopecia that affect not only the hair follicle, but also the sebaceous glands. When I consider conditions like lichen planopilaris and other rare inflammatory skin conditions and diseases, there are limited treatment options available. Aside from corticosteroids and immunosuppressants, painkillers are often used when there is pain. It's truly unfortunate because many people suffer from these conditions. I discussed this in my recent podcast with Dr. William Rassman, the inventor of the follicular unit extraction hair transplant procedure. He mentioned that some of his colleagues have started to routinely biopsy patients before performing hair transplants. This practice is due to the fact that in the past, patients with lichen planopilaris would often experience transplant failures. These issues are more common than we realize, and could explain why some individuals do not respond well to treatments like finasteride, dutasteride, or minoxidil. Their problems may also involve an autoimmune inflammatory condition that attacks the hair follicle and sebaceous glands. Here is a snippet of that interview. Like alopecia areata incognita that can manifest a DUPA-like condition aside from androgenetic alopecia. That being said, have you ever recommended scalp biopsies in your practice when it comes to more atypical patterns of hair loss?
Yes, Dr. Robert Bernstein and Dr. Christine Shaver in New York. Dr. Shaver she's a dermatologist, and she had a particular interest in something called lichen planopilaris, which is another disease of the scalp that causes hair loss. There are a series of diseases of the scalp that cause hair loss, and you don't want to do surgery, hair transplant on people that have fronting fibrosing alopecia or lichen planopilaris or a variety of these other scarring alopecias. So she has made a habit starting to biopsy young men in two places when she has even a suspicion that there might be some underlying disease, even though it doesn't show very well. And she has found an enormous number of patients have lichen planopilaris, which means that these people, if they had a hair transplant, will fail. Eventually, sooner or later, will lose their hair. So when we look at, I look at my career now 34 years in the hair transplant business, and I used to see every once in a while a patient would come in 10 years out, 7 years out. I even remember somebody 3 years out that came to me and he had a beautiful head of hair after the surgery. And then all of a sudden the hair started to fall out. And I always used to think of the hair around the side and back as permanent. It never went away. But at that time, I didn't understand that these people probably had lichen planopilaris and had this autoimmune disease in the scalp. And it was just inactive. And then as they got older, it became active. We find these diseases far more common in women than men. And for that reason, because they're so common in women, the doctors haven't thought of this as a male disease. And yet it is a male disease. And Dr. Staver is basically writing this up now for publication. So I think that this is an important observation. And so to answer the question, you make bad diagnosis.
I see.
I think if I'm suspicious of something, I'll biopsy it.
From what I see on websites like Reddit, people often suspect that they may not only have androgenic alopecia, and because not everyone is getting a biopsy, it could be the case that issues like lichen planopilaris and other conditions are often overlooked.
The problem in the hair transplant industry, and I don't mean to be too accusatory, but there are many doctors that enter this business that just learn how to do FUE and they don't learn dermatology of the scalp. And if they don't learn dermatology of the scalp and the diseases of the scalp, then they're going to not recognize these diseases, and then they're going to transplant these people as they develop balding, and then they're going to fail maybe 3 or 5 years later.
Yeah.
And when they failed in my hands down the road, and this, by the way, in my practice, the numbers that would fail were about 3% that would fail out there in 5, 10, 15 years later. But I'm sure that those 3% were lichen planopilaris, and a diagnosis that was never made. And by the way, nobody knew about it then. It wasn't like I was just a bad doctor. Nobody had talked about it. It was never considered a disease in men. And sure as hell it is.
Now, in my opinion, there simply isn't enough evidence to suggest that KPV could be used to increase hair growth in humans. However, once again, it doesn't mean it is useless, especially when it comes to scalp inflammation. It may have other uses outside of hair growth. We need to keep this in mind, and hopefully its utility may be appropriately assessed in the future. So now we have Thymosin Beta-4, also known as TB500. And guys, my voice is shot, so please bear with me here. Thymosin Beta-4, TB500, has attracted considerable interest in the realms of skin and hair health due to its potential regenerative and healing properties. TB500 is a synthetic version of the naturally occurring peptide Thymosin Beta-4, which is abundantly present in human tissues, including the skin. This peptide is fundamentally involved in the process of tissue repair and regeneration. So in terms of its composition, TB500 is a synthetic peptide designed to mimic the naturally occurring Thymosin Beta-4 found in the body. This peptide is part of a larger family of actin-sequestering proteins that play a critical role in cellular movement and structural integrity. By binding to actin, TB500 facilitates the migration of cells to sites of injury, thereby promoting healing and tissue regeneration. For the skin, TB500 is purported to offer several benefits. One of the key advantages is its potential to accelerate wound healing. This is achieved through its role in promoting cell migration and angiogenesis, the formation of new blood vessels, which are critical components of the body's natural healing process. In the study titled, quote, Simultaneous Quantification of TB500 and its Metabolites in Vitro Experiments and Rats by UHPLC-Q Exactive Orbitrap MSAA and their Screening by Wound Healing Activities in Vitro, unquote, Rahman et al., investigate the analytical methods for TB500, an acetylated peptide derived from Thymosin Beta-4 and its metabolites. They also explore the wound healing potential of TB500 and its metabolites in fibroblasts. The researchers utilized in vitro enzyme systems, including human kidney microsomes, rat liver microsomes, and pooled human liver cytosol, as well as human serum, to investigate the metabolism of TB500. The metabolites identified included ACLK-T, ACLK-T, ACLKK, and ACLK, with ACLK being the most abundant in rat urine. In vivo studies involved administering TB500 to rats and collecting urine samples over a period of 96 hours to analyze metabolite concentrations. The method, developed, demonstrated high sensitivity and accuracy for simultaneous quantification of TB500 and its metabolites. To assess the biological activity of TB500 and its metabolites, and to determine whether they are toxic to cells, the researchers conducted a series of tests. They specifically focused on wound healing experiments using fibroblasts, which are cells essential for the healing process. By examining the effects of TB500 and its metabolites on these cells, they aimed to understand how these compounds influence cell behavior and whether they could support or enhance wound healing. The experiments were designed to reveal if the compounds promoted cell migration and growth, which are critical factors in the healing of wounds. Additionally, the researchers were keen to identify any potential harmful effects of TB500 and its metabolites on the cells, ensuring that their use would not lead to cytotoxicity or damage to cellular structures. The results showed that neither TB500 nor its metabolites exhibited toxic effects at tested concentrations. When it came to wound healing, significant wound healing activity was observed for the metabolite ACE-LKKTE, suggesting that the therapeutic effects previously attributed to TB500 might actually be due to this specific metabolite. To test wound healing, the researchers created small controlled scratches in a layer of fibroblast cells grown in a lab dish. They then added TB500 and its metabolites to the cell cultures and observed how quickly the cells moved to fill in the scratches over time. By taking photographs at regular intervals, they could measure the rate at which the cells migrated to close the wound. This method allowed them to determine which compounds effectively promoted cell movement and wound closure, with ACLKKTE showing particularly strong healing effects. Now, this study isn't too significant or applicable to humans as it is in vitro. When it comes to the toxicity as well, it's not really valid. Cells on their own, in an isolated environment, do not reflect the complexities of the human immune system and body. So, TB500 could be toxic at certain doses. Bottom line here, folks, this peptide does not have many human safety studies, but if it is anti-inflammatory, it could have the benefit of working well with Verteporfin and BPC-157 for post-hair transplant recovery. Here, we may see a better healing factor when it comes to tissue repair with Verteporfin. We observe the impact TB501 of its metabolites had on fibroblast cells. It encouraged recovery after trauma was induced. This behavior, while not observed in vivo on a human subject yet, may have great utility. Perhaps after a transplant, we could use Verteporfin injections alongside BPC-157 treatment in the weeks following the procedure. Additionally, we could create a lipid matrix gel that acts as a bandage enriched with TB500. This TB500 lipid gel bandage could be applied to the donor areas, extracted follicles, or converted into an injectable form. This injectable could be administered alongside BPC-157 and Verteporfin immediately after the transplant and periodically thereafter. But again, nothing promising about hair was uncovered, so that's that. Hopefully that Verteporfin idea is implemented one day by a hair transplant clinician. Here's a somewhat interesting question. Could peptides help restore damaged erecti pili muscles and reverse tough cases of androgenetic alopecia? Well, let's have a look. Treatment with 5-alpha reductase inhibitors are seen as the first line of defense when it comes to combating androgenetic alopecia. We have many studies such as the 10-year Italian study by Rossi et al. And the 10-year Japanese study by Yanagasawa et al. Show us that with long-term treatment and early intervention, hair follicles are somewhat recoverable. However, there are cases when the hair follicle may be too far gone or treatment resistant. For this, we turn our attention to the functions and roles of the Arrector pili muscle. In the study Androgenetic Alopecia, New Insights into the Pathogenesis and Mechanism of Hair Loss by Sinclair et al., the detachment of the Arrector pili muscle from the hair follicle bulge is a pivotal event in the progression of androgenetic alopecia. The Arrector pili muscle is a small band of smooth muscle that plays an essential role in maintaining the structural integrity of the hair follicle. It connects to the hair follicle at the bulge, which is a crucial reservoir of epithelial stem cells responsible for hair regeneration and growth. When the Arrector pili muscle detaches from the hair follicle, it disrupts the connection between the hair follicle and its stem cell niche. This detachment may significantly affect the hair follicle's ability to regenerate and maintain its normal function. The loss of this muscle epithelial attachment leads to a degradation of the supportive environment necessary for the stem cells to function optimally. These stem cells are crucial for initiating the growth of new hair during the anagen phase of the hair cycle. Without the stabilizing influence of the Arrector pili muscle, the hair follicle's capacity to regenerate diminishes. The stem cells in the bulge area become less effective at proliferating and differentiating into new hair-producing cells. This impairment contributes to the miniaturization of hair follicles, where, in the context of androgenetic alopecia, hair follicles produce progressively thinner and shorter hairs. As miniaturization continues, the scalp hair follicles eventually cease to produce terminal hairs altogether, leading to visible baldness. Sinclair's research also provides insights into why male and female forms of androgenetic alopecia exhibit different patterns and responses to treatment. In males, the progressive loss of the Arrector pili muscle's connection to hair follicles may be more pronounced, leading to the characteristic pattern baldness. In females, although the Arrector pili muscle also detaches from the follicles, the diffuse thinning pattern suggests a more gradual or less pronounced detachment process, which may partly explain the different clinical presentations and progression rates between the genders. It should be noted that males may experience female pattern types of hair loss and present as diffuse thinners. Likewise, the reverse is true with women. So let's examine the differences between conventional male pattern baldness versus female pattern baldness and relate this to the Arrector pili muscle, the study Divergent Progression Pathways in Male Androgenetic Alopecia and Female Pattern Hair Loss. Trichoscopic Perspectives by Kamishima et al. Looks into the nuanced differences between male androgenetic alopecia and female pattern hair loss, which are both forms of androgenetic alopecia. The research aims to explore how these conditions manifest differently at the trichoscopic level and the implications for treatment strategies. Male androgenetic alopecia typically presents with a reduction in hair diameter and density, predominantly affecting the vertex and temple regions of the scalp. In contrast, female pattern hair loss is characterized by diffuse thinning, mainly in the central, frontal, and parietal areas. This gender-specific variation in hair loss patterns is significant because it highlights the different pathways and mechanisms underlying these conditions, even though both are fundamentally driven by androgenic factors. A crucial aspect of this study is the analysis of the Arrector pili muscle's role in androgenetic alopecia. The Arrector pili muscle, a tiny band of smooth muscle, connects to the hair follicle at the bulge, an area rich in stem cells crucial for hair growth and regeneration. In male androgenetic alopecia, the progressive miniaturization of hair follicles is accompanied by a detachment of the Arrector pili muscle from these follicles. This detachment is thought to exacerbate hair follicle miniaturization, leading to a reduction in hair diameter and density and ultimately irreversible hair loss. The study found that in male androgenetic alopecia, hair diameter decreases early in the disease progression, followed by a reduction in the number of hairs per follicular unit. This sequence suggests that follicle miniaturization initially impacts the size of individual hairs before it reduces the overall number of hairs produced by each follicle. Conversely, in female pattern hair loss, the condition starts with a reduction in the number of hairs per follicular unit, followed by a decrease in hair diameter. This indicates a different mechanism or order of progression where the hair-producing capacity of each follicle diminishes first. Now, the implications of this detachment are significant when considering treatments aimed at androgenetic alopecia. Right now, the standard treatments, such as 5-alpha reductase inhibitors like finasteride or dutasteride, work by reducing the levels of DHT in the scalp and follicular tissues. But if what Sinclair et al. Highlights is true, then we may have a bottlenecking in some patients when it comes to treating the androgenetic alopecia, such that for those that start to treat their baldness late, the number of hair follicles that could possibly be saved and have their miniaturization partially or wholly reverse would be greatly reduced. So, like Sinclair and colleagues suggest, developing treatments that may potentially target the Arrector Pili muscle and reattach it to the hair follicle would probably help reverse hair loss. And there is no restorative surgery we could do to reattach this muscle to the hair follicle. Now, I would speculate that peptides and the promise of their restorative properties may be an avenue to explore. When taking a look at the Arrector Pili muscles, we can note that they are connected to the hair follicles and are controlled by the sympathetic pilomotor nerves. So this means that the Arrector Pili muscles, which cause hair to stand up, are regulated and activated by specific nerves that respond to certain stimuli. This would be either states of coldness or emotional responses like fear. So, this may be me joking here, but there might be an ever so slight chance that watching a scary movie or going on a roller coaster ride, or hell, maybe even having your crush say they love you, is beneficial to scalp hair growth. But somebody might want to see the science on that, so maybe we should get a study on that. Anyway, going back to the video. This is due to how the nerves release a neurotransmitter called norepinephrine, which causes the Arrector Pili muscles to contract, resulting in the erection of hairs, commonly known as goosebumps. One potential strategy to enhance hair growth involves using pharmacological agents that mimic the action of norepinephrine. These drugs, known as adrenergic agonists, could be applied topically to stimulate the sympathetic nerves directly. By promoting the contraction of the Arrector Pili muscles, these agents could help maintain their attachment to the hair follicles, potentially preserving the follicle's structural integrity and supporting hair growth. Peptide-based treatments also offer promising avenues for targeting the Arrector Pili muscles. So, some peptides could be designed to enhance the release of norepinephrine from the sympathetic nerves or to mimic its effects. So, such a peptide would be a short chain of amino acids engineered to interact with the receptors or the release mechanisms associated with norepinephrine, and it should have regions that resemble the structure of norepinephrine that can also ensure effective binding to the adrenergic receptors or to stimulate norepinephrine release from the sympathetic nerves. We can take a look at the literature review article titled, quote, "Recent Progress in the Understanding of the Effect of Sympathetic Nerves on Hair Follicle Growth," unquote, by Jarui Zhang et al. Explores the significant role of sympathetic nerves and their neuropeptides, especially norepinephrine, in promoting hair follicle growth. The authors detail how norepinephrine, released from sympathetic nerve fibers, interacts directly with hair follicle stem cells through specialized synapse-like connections, effectively triggering and maintaining hair growth. A critical aspect discussed in the review is the short half-life of these neuropeptides, which presents a challenge for their sustained therapeutic use. To overcome this, the authors suggest the potential of local application techniques and advanced drug delivery systems, such as liposomes and extracellular vesicles. These methods could protect the neuropeptides from rapid degradation and ensure a more prolonged and targeted stimulation of hair follicle stem cells. These peptides would help maintain the tone and function of the Arrector Pili muscles, ensuring their attachment to the hair follicles and thereby supporting hair growth. Additionally, potentially regenerative peptides such as Thymosin Beta-4 or KPV could be investigated for their ability to promote tissue repair and regeneration. By repairing and strengthening the connections between the muscles and hair follicles, regenerative peptides could play a significant role in maintaining the health of the follicles and encouraging hair growth. Furthermore, if verteporfin is proven to be an effective means of scarless tissue regeneration in humans, I could envision a protocol designed to restore large areas of a bald scalp back to a state where Arrector Pili muscle is restored. This implies a trauma, then injection, then healing response. It is within that healing period where I could see peptides whether known now or in the future, being used to heal and generate new skin structures, including Arrector Pili muscles, sebaceous glands, and hair follicles. Okay, well, that's pretty much it for this video, or the main part of this video. We're going to be going on to another segment, which will mainly focus on peptides and skincare. So this has been a very, very long video. Imagine me editing this, right? But again, thank you guys so much for the recent support and for watching this. I just want to give some conclusion statements to the previous section. I think that some peptides may be able to help, especially the new peptides that Amplifica's researching, right? But the common ones that we can find today on the market, they seem to be more intimately involved in skincare and reducing inflammation, and that's all fine, right? But it's not necessarily a direct growth stimulant. It could possibly help keep your scalp inflammation in control, right? But it isn't going to be an alternative to minoxidil. So please don't get carried away with putting BPC-157 or 157 on your scalp and GHK-Cu, just drinking that or doing whatever crazy thing people are doing these days with these peptides. Do not think that those peptides are any alternative to the current treatment that we have today. So, thank you so much. Let's move on to the next section. And hey, subscribe and share if you thought this video had some informative studies that could possibly help somebody you know and yourself. Anyway, see you on the next one. Reducing wrinkles and maintaining youthful skin has long been a central focus in the field of cosmetic science. As people age, the natural decline in collagen production leads to visible signs of aging, such as wrinkles and sagging skin. Modern research in anti-aging treatments increasingly explores the use of synthetic peptides, which offer innovative and non-invasive alternatives to traditional methods like Botox. So, in today's video, I'm going to be looking at two notable peptides. These peptides are Argireline and Leuphasyl. Argireline is a synthetic hexapeptide that mimics the effects of protein SNAP25 to reduce facial muscle contractions and thereby minimize wrinkle formation. Leuphasyl, on the other hand, works by relaxing muscle activity through a different pathway, offering a complementary approach to wrinkle reduction. Both are derivatives of IGF-1 and may be classified as IGF-1 peptides, such that they have a pronounced effect on increasing collagen synthesis, which may potentially restore skin. Now, before we do this literature review, I'd love it if you guys were to share this video with a friend, like, comment, and subscribe, and if it helped you out, consider becoming a member of this channel for as little as $2 a month. Links, as always, are in the description below. So I'm done chilling there. Let's go on to the next part of this video. So we're going to be looking at the first study by Yan Wang et al. Titled, quote, "The Anti-Wrinkle Efficacy of Argireline, a Synthetic Hexapeptide in Chinese Subjects, a Randomized Placebo-Controlled Study," unquote. The researchers sought to evaluate the anti-wrinkle effectiveness of Argireline in Chinese individuals. Argireline, as I mentioned before, mimics the N-terminal end of the protein SNAP25, which is involved in the release of neurotransmitters. By inhibiting vesicle docking and interfering with the release of catecholamines, Argireline effectively reduces the muscle contractions that can lead to wrinkle formation. This means that when applied to the skin, Argireline can help smooth out facial lines by limiting the movements of facial muscles that cause wrinkles to form over time. Essentially, it provides a non-invasive way to achieve similar effects to Botox, which also targets muscle contractions but through a different mechanism. This makes Argireline a valuable component in anti-aging skincare routines as it helps diminish the appearance of wrinkles by addressing one of their primary causes, repeated muscle movement. And I'm kind of doing that right now. As I'm talking, I'm raising my eyebrows and I'm bringing them down. So hopefully I can stop that and I don't get any more wrinkles. This was a somewhat decent study with 60 participants who were randomly assigned to either receive Argireline or a placebo treatment in a ratio of 3:1. Over a period of 4 weeks, participants applied either Argireline cream or placebo cream to their periorbital wrinkles twice daily. The efficacy of the treatment was assessed both subjectively and objectively. The subjects ranged in age from 25 to 60 years old. For subjective evaluations, the researchers used the Daniel's classification and the Siemens standard. Kind of a weird name there, Siemens standard. I hope you guys aren't using that for skincare. But anyway, the Daniel's classification rates the severity of wrinkles on a 4-point scale: none, mild, moderate, and severe. Siemens standard measures overall improvement on a 5-point scale, ranging from 0, no charge, to 4 being complete improvement. These systems helped researchers quantify changes in wrinkle appearance before and after the treatment. Objectively, silicone replicas of the skin at the application areas were made before the treatment and after the treatment. These replicas were analyzed with a wrinkle analysis apparatus to assess the changes in the roughness and wrinkle depth. When looking at the results, they were significant. In the Argireline group, 48.9% of participants showed an improvement in their wrinkles compared to 0% in the placebo group. That's a pretty big margin. The objective analysis showed a significant decrease in the parameters of skin roughness in the Argireline group. It should be noted that no significant changes were observed in the placebo group, which indicates a clear reduction in the wrinkle depth and volume in those treated with Argireline. It's worth to note that there were no adverse effects reported during the study, suggesting that Argireline is a safe and effective treatment for reducing the severity of periorbital wrinkles. The study concluded that Argireline significantly improves wrinkle appearance in Chinese subjects, and probably everyone else, and supports its use as a non-toxic alternative to Botox when it comes to wrinkle reduction. Likewise, results are mirrored in the article titled, quote, "The Efficacy and Safety of Leuphasyl, a Botox-like peptide," unquote, by Dragomescu et al. The focus is on the innovative use of peptides here in the cosmetic science, particularly in the context of anti-aging. The primary aim of this study was to evaluate the effectiveness and safety of different concentrations of Leuphasyl, a synthetic peptide, in reducing wrinkles. 3 emulsions with varying concentrations of Leuphasyl, being 0.5%, 1%, and 2%, were formulated. The base composition of these emulsions included several ingredients such as polysorbate 60, cetosterol alcohol, Vaseline, glycerol, dimethylconyl blend 20, liquid paraffin, and distilled water. The concentration of this distilled water was adjusted to account for the amount of active agent that was added, so the amount of Leuphasyl that was added to the overall solution. To ensure the emulsions were suitable for application to the skin, their rheological properties were evaluated using a rheometer. This evaluation helped determine how easily the product could be spread and its adhesion to the skin surface. Measurements were taken at a constant temperature of 25 degrees Celsius using a cone plate measuring device. The emulsions were applied daily by the volunteers to specific facial areas: the frontal region, which would be the interbrow area above the corrugator supercilii muscle, and the periorbital region above the orbicularis oculi muscle. These areas were chosen because wrinkles in these regions are primarily caused by muscle contractions, and the aim was to use Leuphasyl to see if you could actually relax these muscles, thereby reducing wrinkles, and that's the study. Throughout the 2-month period, the effectiveness of the emulsions were monitored using the ProDerm Analyzer, and this device provided a 2-dimensional visualization of the wrinkles, capturing images of a 1 centimeter squared area of the skin and highlighting the wrinkles as blue lines. These lines were then measured in millimeters to quantify the changes in wrinkle size. Weekly evaluations were conducted to track the progress of wrinkle reduction, and the results showed that 2% concentrations of Leuphasyl produced significant anti-wrinkle properties, with a 34.7% decrease in the interbrow region and a 28.4% decrease in the periorbital region. The study also noted that Leuphasyl effectiveness varied between the two regions, and this may be due to the anatomical differences in the muscle structure. You see, the frontal region showed better results than the periorbital region, possibly because the former involves fewer and more superficial muscle fibers. Now, there was one part of this paper that caught my attention, discussing Leuphasyl and Argireline in relation to human insulin-like growth factor, or IGF-1. IGF-1 itself, and perhaps its derivative peptides, are capable of stimulating cellular growth and regeneration. This makes them particularly promising candidates for anti-aging treatments aimed at promoting skin rejuvenation and repair. In the context of skin care, IGF-1's ability to promote collagen synthesis is especially noteworthy. Collagen is a fundamental protein in the skin, contributing significantly to its structure, strength, and elasticity. As we age, collagen production naturally declines, leading to the appearance of wrinkles, sagging, and all those other things we know about aging. So if you're able to enhance the synthesis of collagen in those specific tissues, then you can possibly reverse or mitigate aging and get a more restored youthful appearance. A study by Yoshida and colleagues titled, quote, "Insulin-like growth factor 1 increases synthesis of collagen type 1 via induction of the mRNA binding protein LARP6 expression and binding to the 5-stem loop of Col1A1 and Col1A2 mRNA," unquote. What a weird, strange title to read out loud. Demonstrates how IGF-1 or insulin-like growth factor 1 plays a significant role in boosting the production of collagen type 1. And this type of collagen is crucial for maintaining skin strength and elasticity. IGF-1 achieves this by increasing the levels of the protein that I mentioned before in the title, and this is called LARP6. LARP6, short for L-ribonucleoprotein, domain family member 6, can be thought of as a foreman at a construction site. You see, it binds to a specific part of the collagen mRNA, ensuring that the collagen is produced effectively and correctly, much like that foreman ensures that every part of a building is constructed accurately according to a sort of blueprint or plan. This binding process is essential for forming strong fibrous structure of collagen type 1, which then gives skin its tensile strength and stability. The study found that IGF-1 increases the amount of LARP6 and it leads to more collagen being made and stored in the smooth muscle cells. And the study goes on to mention that the process could work through a few pathways that involve some molecules, and these molecules are Pi3K, AKT, and P70S6K. I'm not going to go into what those molecules' full names are. That would be too arduous for me. I think it's just better to just leave it at that. But essentially the point here is this, right? I certainly think that incorporating Argireline and Leuphasyl in some sort of skincare routine might help to reduce fine lines and wrinkles. So when it comes to safety, I think these are some pretty substantial studies that point to these peptides as being skin safe. However, to be safe, you might want to do a patch test of some sort, and you might want to check if you have any allergies to any of these peptides, because that could be possible. Ultimately, the best call would be to refer to the opinions of a dermatologist, especially one that specializes in anti-aging, and not some guy like me who has a mic and a YouTube channel. But I love you so much for listening to this video and, subscribing if you haven't already. So that's pretty much it for this video. I've been recording so much this week when it comes to these peptide videos, so I might cut this up in the future. As of recording this right now, it's what is it? What's today's date? Let me check real quick. What's today's date? It is June 20th, 2024. So yeah, you might see this also snipped up and put out later, but thanks for watching this video, guys. Thanks for supporting this channel, and I hope to get this edited and put out sometime this week, and then snipped up and put out in the future, later on in the future, if that makes sense. So I'm rambling at this point. I just want to get this over with. Anyway, thanks for watching, and I'll see you on the next one. Bye, guys.